Good morning, everyone. Let's walk through this clinical case together because it perfectly demonstrates a very important shift in how we diagnose primary progressive multiple sclerosis. As future physicians, you will frequently encounter cases that don't fit the classic textbook description of widespread brain lesions, and this patient is a prime example. We have a 43-year-old gentleman who came to the neurology clinic with a 3-year history of slowly worsening weakness in both legs and urinary hesitancy. On examination, he shows clear upper motor neuron signs, brisk reflexes and bilateral extensor plantar responses, along with sensory changes. Because his symptoms have been steadily progressive for well over the required 12-month baseline, he firmly meets the clinical timeline needed to suspect a progressive form of MS. Now let's look at his imaging and lab work, because this is where the diagnostic challenge usually begins. His brain MRI comes back completely normal. Not a single demyelinating lesion is visible. However, look at his spinal cord MRI. It reveals 3 distinct, short-segment posterolateral lesions located at the cervical and upper thoracic levels, specifically at C2, C3, T4, and T6. Additionally, his lumbar puncture is positive for CSF-restricted oligoclonal bands, and we have confidently ruled out any alternative etiologies. If we were applying the older 2017 McDonald criteria here, a completely normal brain MRI would often leave clinicians in a gray zone, causing diagnostic delays because older frameworks traditionally looked for a multi-regional spread across different areas of the central nervous system to establish dissemination in space. This brings us to the crucial teaching point of the new 2024 McDonald Criteria Revisions. The biggest update affecting progressive onset MS is how we handle dissemination in space. The 2024 criteria now explicitly state that if a patient has 2 or more independent spinal cord lesions, that finding alone is officially sufficient to fulfill the dissemination in space requirement. You no longer need to see concurrent brain involvement or prove a spread across multiple distinct anatomical zones. Therefore, by combining his 3 years of clinical progression, his 3 distinct spinal cord lesions satisfying dissemination in space, and his positive CSF biomarkers, this patient cleanly and confidently achieves a definitive diagnosis of PPMS under the 2024 criteria. This update is a major milestone because it allows us to diagnose spinal predominant MS much earlier, sparing our patients from prolonged anxious waiting periods.